A radiologist's eyes scan a chest X-ray. They are among the most highly trained visual experts on the planet, capable of spotting a tiny, cancerous nodule hidden among the complex shadows of ribs and tissue. But they are human, and humans are susceptible to a peculiar cognitive bias called satisfaction of search. Once you find one abnormality, your brain's vigilance drops, making you statistically less likely to find a second or a third, even if it's right there. This isn't a failure of skill, it's a feature of how our attention works. We are brilliant at finding what we expect to find, but disease doesn't care about our expectations. An AI, however, doesn't see an X-ray. It sees a grid of numbers, a multi-dimensional array of pixel intensities. It feels no satisfaction. A type of AI, called a convolutional neural network, processes this grid not all at once, but in layers. The first layer might detect simple edges. The next layer combines those edges into textures. The next combines textures into rudimentary shapes, and so on. It learns a visual hierarchy from pure data. Because it isn't trained on textbook examples alone, but on millions of images, it can identify patterns that have no name. It can flag an area not because it looks like a textbook nodule, but because its numerical texture shares a deep statistical similarity with thousands of confirmed early-stage cancers it has previously analyzed. This new way of seeing extends to the microscopic world. A single pathology slide of a tissue sample, when digitized, can be a gigapixel image, an area larger than 1,000 high-definition TV screens. A human pathologist must manually pan and zoom across this vast landscape, searching for mitotic figures, cells in the process of dividing, a key indicator of cancer's aggressiveness. It's a laborious, subjective, and exhausting task. An AI, however, can analyze the entire gigapixel slide in minutes. It can count every single cell, measure the precise ratio of each nucleus to its cytoplasm, and classify 10,000 cells before the pathologist has finished their first cup of coffee. It provides a quantitative, objective measurement of the entire tissue landscape, revealing patterns of disease distribution that are simply too large-scale for a human to perceive by peering through a microscope. Diagnosis isn't limited to what we can see. Can you hear the difference between a cough from a common cold and a cough from someone with pneumonia? Probably not, but an AI can. By converting the sound of a cough into a spectrogram, a visual representation of its frequencies, AI models can detect minute changes in the sound's decay and resonance. These subtle acoustic signatures act as digital biomarkers. Researchers at MIT have even demonstrated an AI that can detect asymptomatic COVID-19 cases with high accuracy, just from the sound of a forced cough recorded on a cell phone. It's hearing muscular fatigue and airway inflammation that is completely imperceptible to the human ear. It's a physical exam conducted without ever touching the patient. The deepest patterns of disease are written in a code we are only just beginning to understand: our DNA. Your genome contains about 3 billion base pairs. Finding a disease-causing mutation can be like finding a single misspelled word in a library containing 1,000 copies of War and Peace. AI excels at this impossible scale. Instead of looking for a single bad gene, it performs what are called genome-wide association studies. It compares the genomes of thousands of people with a disease to thousands without, identifying complex networks of tiny variations that, together, create a predisposition for a condition like heart disease or diabetes. It's not just finding the typo, it's understanding the grammar of our genetic language, revealing how hundreds of small changes can collectively rewrite our medical story. So how does a busy doctor use all this? Through clinical decision support systems. Imagine a patient arriving in the emergency room. The AI doesn't just display their heart rate, it analyzes the full EKG waveform. It doesn't just list their lab results, it cross-references them with their genetic profile and medication history. It instantly scans the latest 50,000 research papers on kidney disease. Within seconds, it presents the doctor with a ranked list of possible diagnoses, each with a probability score and links to the specific data points that support it. The AI isn't replacing the doctor. It's acting as a cognitive exoskeleton, augmenting their memory and analytical abilities to handle a world of exponentially growing medical data. The doctor makes the final call, but their decision is superhumanly informed.
Monotony has grown fast. Nearly 2,700 people have watched in the last few weeks, yet less than 0.03% are subscribed. It would mean a lot if you joined by hitting subscribe. And again, thanks for watching.